Today I will be talking to Stabilitech Biopharma's Dr. Jeff Drew about its groundbreaking orally delivered vaccine for COVID-19. Morning, Jeff.
Good morning, Tim. How are you today?
I'm good, thank you very much. Thanks for speaking to us. I know you're very busy. I had a really interesting conversation and interview with Wayne Channon last week, and it turns out that you've got two things going on there that are of real interest, I think, to people. One is, of course, which is your vaccine development for COVID-19, and also an orally administrable pill containing the vaccine. Can you tell us a little bit about that, Jeff, please?
Yeah, as a company, we started out as a stabilization platform, stabilizing vaccines and viruses. And fast forward in a few years, we realized that we could possibly use that stabilization technology to enable the delivery of viral vectors to the gut to be used as a platform for expression of proteins and vaccines. We've tried the system in Zika virus, and we found that we could make an oral deliverable capsule that you can administer to test subjects via the gut. It survives through the stomach and it delivers its cargo to the intestines where the antigen is expressed. And we found in the subjects that we administered it to, in the Zika vaccine, they were completely immune to Zika infection. And that's quite a novel finding, really, that you could deliver a vaccine orally and give full protection. And we're hoping to adopt that technology and apply it to COVID-19, because one of the additional things that this approach does is to give a more widespread immune reaction. So we get involvement of the mucous membranes, the mucosal immunity, as well as systemic and cellular-based responses.
Jeff, you mentioned the Zika outbreak. Were you working on that?
Yeah, that was the first application of the oral vaccine technology. We were fortunate enough to win the support of the UK government to develop a Zika vaccine. And this was when the crisis was ongoing in Brazil a few years ago. And we were able to use that money to develop our platform to the level where we were getting ready to put it into man as a trial. But then COVID sprang up and we retasked everything that we were doing toward that effort so that we could duplicate our Zika vaccine success in the COVID-19 vaccine.
When did you first hear about, first find out about the COVID? What was your first contact with that, and what was your first understanding of that, Jeff?
Well, I've always been keeping my eye on the virus situation worldwide, because a pandemic was essentially long overdue. So when I first started noticing this, the outbreak in China was being reported upon, as soon as there were reports of sustained human-to-human transmission, that's when I decided that maybe we should refocus our efforts in order to stay ahead of the curve. Because had we waited for the disease to hit, we would have been several months behind where we are now. So because we retooled in January, we were able to make and manufacture the candidate vaccine, which we have today. And now we are going to be beginning the testing in animals and then hopefully into man in a few weeks, 6 to 8 weeks.
That's fantastic, 6 to 8 weeks. So that'll be the first human trial.
It will. It's a very, very aggressive timeline, but I think the crisis dictates that we need to give our best efforts to get it as fast as possible.
So you've developed a system for stabilizing vaccines at room temperature. So that means that you can deliver this vaccine as a pill.
The trial vaccine that we've made, as I mentioned, is Zika. In that format, that's a powder, dry powder in a capsule, which is then thermally stable and can be administered by the recipient themselves, and they can be posted if needs be. We think in this current pandemic situation, the successful vaccine would be very suitable to self-administration, because the last thing you want are infected people mixing with uninfected people at vaccination centres, because there would need to be a very large vaccine drive in order to get sufficient people vaccinated against the disease. And the last thing you want is cross-contamination with the healthy and the sick.
You've taken a mucosal approach to this vaccine and the way in which you deliver it, Jeff. Could you explain a little bit about that? Because I've heard quite a bit about this, but other people won't know and won't understand.
Yeah, the oral route of administration is quite unique, really. What we tend to do is to deliver the virus vector to the stomach, where it sits for a few hours. That's where the thermal stability comes into play. Then the capsules pass through into the gut, and the virus is released in the gut and then can infect the gut mucosal surfaces. Because of this, there will be a strong mucosal response. Now, we think that this will benefit this disease because it's been shown that there's very little viremia, which is viruses in the blood. So a systemic only approach perhaps isn't the full picture that we will need. The majority of the immune responses, or the immune cells, if you like, are located in the mucosal surfaces. They're the first port of entry of anything to invade us. So the majority of the immune response is geared up to those surfaces. So by doing a systemic only approach, it seems to be leaving an awful lot of the immune repertoire out of the picture. Now, by administering as we administer it, we believe we'll have a more comprehensive immune reaction and possibly a much more protective reaction as a result.
Jeff, how does this differ from flu, which is a disease that everybody's familiar with, and why is this being taken so seriously?
The short answer is this is a completely novel disease. This has never been in the human population before. And because of that, there's no protection, there's no immune reaction in anyone to this disease. With flu, you have some residual resistance, if you like. When you have a flu infection, you get antibodies to all the different flu proteins, and the human population per se has some protection against those new flus that arise. Occasionally you get such a dramatic change that people aren't protected at all, and that's the kind of situation we had in 1918 when there was a flu pandemic. The virus changed so substantially, there was just no protection. So from an animal perspective, the flu is very different to COVID. COVID can only really be compared to the 1918 flu, where we have no resistance, we have no protection, we have no vaccine. And that's quite unheard of in today's day and age.
With your system of delivery, Jeff, what is the time to immunity?
That's a very interesting, very important question, Tim. We saw in the Zika vaccine, when we applied it to test subjects, we were able to raise a full protective immune response in 3 weeks. So I think most of the competing technologies that are out there for making vaccines, they involve more than one application of the vaccine, and there are several weeks between those applications. Mm-hmm. So it's a few months before a protective immune response is raised, and that delay in onset of immune response could be critical in circumventing this pandemic. I think the fastest speed to immunity is the way we must go.
Jeff, viruses mutate. How do you target your vaccines?
Right, the key to a successful vaccine is to find the antigen that gives the most protection against infection. So we've selected, like other guys out there in the vaccine sphere, we've selected the COVID spike protein. Now that's the first protein that'll come into contact with the cell. So that is like a lock and the key. So the spike protein will dock with its receptor on the cell, and then it'll be taken into the cell. So a successful vaccine should really stop that interaction from occurring. You mentioned about mutation. With flu, there's quite a few mechanisms whereby the flu can mutate. There are several strains circulating, well, hundreds of strains circulating in any given season. The flu is able to recombine because it's segmented, so it can take segments from other flus, other strains, and recombine that way. It can have what's called antigenic drift. It can change subtly so that the actual receptor site can change. So there's a lot of mutation in the flu. With COVID, the situation is different. There may be mutations that occur to make it more fit and more infectious so that it can perpetuate itself. But the spike protein itself, it seems to be remaining very, very stable. There are very few mutations that are occurring on that protein. I keep monitoring the situation every time the sequence comes out. So I was looking at the original Chinese sequences, I looked at the Italian sequences, the Spanish sequences, the American sequences, our sequences. And there are only a few mutations, a few point mutations in the DNA structure of the spike protein. This is over several thousand bases. So there's very little change occurring in that spike, and that's fantastically good news. That means that a vaccine will potentially be able to, a single vaccine could attack all of these. There are two circulating strains, but their only strains are different because of internal DNA changes, not the spike protein. So a single vaccine should be able to attack all of the strains that are circulating.
What would happen if another one came along, Jeff? How would you deal with that?
Well, that again, that's another benefit of the approach that we're taking. We're making a vaccine that's pretty much a cut and paste type vaccine. You can take DNA now and you can cut up whatever you like out of something and put another slice of DNA into it. Now, our vector is using a run-of-the-mill adenovirus vector. And the technology is very, very evolved that you can cut a slice out and put a slice back in. So should another escape mutant come through from COVID-19, if this vaccine is being used, we in very short order could take the DNA in that novel virus, put it into our vector and generate another vaccine really, really quickly. To get to the point where we are now with our candidate research virus stock, it took us about 3 to 4 weeks in total. Now we're generating the GMP manufactured lots, and then we're going to be going into man. So to chop out the gene, replace it with something else, it's very, very quick, very simple, very straightforward.
Jeff, so you seem to have two things going here, which are in a really advanced stage. You seem to have A, a vaccine, and B, an orally administered delivery system, which is actually a capsule. Where do you go now as a company? What are your next steps as a company to take this forward to production?
Right, the next steps for us now is to do some of the animal testing. We've actually got a small safety trial ongoing as we speak, and it's looking very, very good. So that's one of the next steps in the ladder. We've also engaged with a contract research manufacturer to produce what's called a GMP manufactured lot, which is manufactured in very stringent, very tightly controlled conditions, so you know exactly what it becomes exposed to, etc., etc. So we've got those things going. We're also, as a small resource limited company, we're also trying to raise additional funds to take it to the next stage, because the next stage after this GMP manufacture is then to look at the safety profile in human subjects, volunteers. So that's a very expensive stage to go through. I think once we've demonstrated that, and we've also looked at some efficacy studies and challenge studies in applicable models, once we're at that stage, we've demonstrated that it's safe in man, it's efficacious in animal models. I think then the government would take over and start manufacturing this big time, which is what it would require, because it's going to need national infrastructure in order to generate sufficient vaccine for this. As I said, we're a small operation. Most of the companies that we work with would be stretched to produce enough for the global demand. So it's going to take some sort of coordinated effort to corral everyone together to produce enough vaccine to distribute to everyone, which would be fantastic.
Jeff, thanks for taking time out of your day to talking with us today. We wish you all the luck in the world, and thank you very much.
Thanks, Tim. It's been a pleasure.